Hello, everybody, and welcome to the first Connecting Knots event of 2021. I'm just getting some echo. There we go, that's better. So, hi everybody, I'm Paul Devlin, I'm the Trust Chair, and I'm doing a steer through of today's session. So, first one of the year. Welcome to 2021. To paraphrase The Who, meet the new year, same as the old year is what it feels like to me. And I did just want to start off by putting out a massive thank you to all of you for keeping on through this incredibly intense period at the moment, and we'll hear some reflections around that as we go through the session today. But not only keeping our services going, working with COVID, but also the incredible work around vaccinations. Big thank you from me and the board. So in terms of today's event, just say a few words about it. We'll shortly hear from John with some view from the Chief Exec's desk about some of what's going on. We're doing our first look into our values, and we're going to have a short video piece to take a look at there. We'll be doing a piece on health and wellbeing service offer. Also hearing about the personality disorder pathway and getting an update around CQC as well. So obviously we've got a lot to get through. We'll also hopefully have some Q&A, so please do use the Q&A function to put questions in. We will do our best to get through as many questions as we can, but as usual, any that don't get answered, we will be putting a briefing round afterwards that will pick up any questions that go unanswered in the actual session today. Then I think the only other thing to mention is that we'll also have a little bit of look at our positive stars as well. So I think that's all that I need to say at this stage, and what I'm going to do then is hand across to John Bruin, Chief Exec. John, over to you.
Thanks, Paul. Welcome everybody, and looking forward to a really packed and entertaining agenda today. We've got some really good pieces to go through, so you'll be pleased I won't be taking up the full 15 minutes with my overview, just to get, so we've got a bit more time to focus on some of the other things, particularly excited about starting to look in a bit more detail around our values. So in terms of headlines, you won't be surprised to know that the 3 or 4 things I want to talk about are much the same as they have been in previous weeks and months, and a bit like Paul's reference to The Who, we're still in the tail end of 2020 really with regard to where things are. So all things lockdown. You'll be aware that we've put out quite a bit in the comms and messaging over the last couple of weeks about urging people wherever possible to work from home, and if your role entails clinical work, we are trying wherever possible to maintain face-to-face for some of our most vulnerable patients and service users. And I think the headline at the moment is that we're doing a pretty good job on that. There's so much demand and need out there, and despite everything, everybody's doing a tremendous job to keep things up and running wherever possible. So again, a huge acknowledgement and thank you to everybody that's involved in that 24/7. It's a huge task, and we do appreciate it. And it's going to be tough for another couple of weeks at least. You'll have seen nationally some of the case rates are starting to plateau and indeed fall in some areas. And we're all familiar now, aren't we, with the lag behind that in terms of hospital admissions to critical care, and sadly the death rates. And there are still some case rates that are yet to plateau in our county. So we've still got quite a bit more to get through, and we just got to keep managing as best we can, and supporting all our staff across the whole organisation, encouraging people to remember that phrase about it's okay not to be okay, and if people need a bit more support or a bit of time out, then that's fine, and we'll try and manage that. There is a bit of good news further on in terms of the vaccinations. I'll come to that in a minute, but just to sort of finish on the roundup, we're currently managing about 15 outbreaks, 15 across the organisation, which is a lot, and we've got some quite big ones in some areas. I suppose it's sort of accepted that they're a part and parcel of COVID being so prevalent that we are, despite people's best efforts, we are going to continue to get outbreaks. But to urge people to continue to practice the social distancing, the use of PPE, and the regular use of lateral flows a couple of times a week. And again, to re-emphasise that there's some really brilliant practice. The most likely time that people drop their guard is when you come away from an acute environment or a work environment, and whether it's a dining, it's in the kitchen, it's just a bit of chill time, and that's a pressure point for transmission. I mentioned lateral flow a couple of weeks ago. We did some pieces on the need to continue to report those, and we had a brilliant response. Thousands of additional reporting of lateral flow results. There are still one or two areas where the numbers are quite low, and the actual numbers that we've got when we report outbreaks externally, whether it's to NHS England and whether it's to PHE, Public Health, we've got relatively small numbers in terms of percentage of staff reporting the lateral flow, and as we said previously, it is mandated that we're asking staff to use this and report it. So if we could continue to urge people to keep reporting your results, and you can do it retrospectively. Don't sit there thinking, oh, I've not done it for 4 or 5 weeks. If you've got those results, send them in and we can log it, and it will also help us in terms of ordering the next supply to come in. So probably the hottest topic then is vaccinations. The latest scores on the doors, you'll have seen nationally that the NHS hit the target for yesterday, Sunday, 3.9 million. We just had the numbers reported this morning, and the Midlands region's proportion of that was 711,000 by last night, and the region actually achieved 743,000. And this doesn't happen very often, but got praised on the national call for knocking it out of the park. So we've contributed to that. I know lots of our staff are involved, and it's a really good place to be. As a system within the county, we're still a bit behind the curve in terms of the proportions of people that have been vaccinated in care homes and that are over 80. And we've got some really tough deadlines to meet for the end of this week and the end of this month on those. And we're still at the behest of supply chain issues. So there's a big task going on there. More broadly for our staff, we've estimated that we've had about 2.5 of our 7,000 and a bit clinically facing staff vaccinated, 2,500. And that's with managing the challenges of supply over the last few weeks, and supply will continue to increase quite significantly over the next few weeks. And to say that we are now going to be releasing more bookings that staff can book onto, and we'd urge you just to double check when you are booking that it's for a first dose, and that you are clinically facing in your role. And again, I'm pleased to report that when we put that message out last week, the vast majority of staff stuck to that. We had a very limited release last week, and I know there were some frustrations that by the time people even saw the message, it was closed because it was full. Over time, that will become less of an issue as more slots become available at a number of different locations across the county. So again, thank you to everybody for your patience. I know that very many people are keen to get done as soon as possible. And remember, the target for this priority group, health and social care staff, is by the middle of February, and we're on course to hit that. So that's really good news. We had been hoping to become what's called a hospital hub, whereby we could order and store, particularly the AstraZeneca vaccine, which you can keep in fridges, and that would have given us much more autonomy and control over distribution, making sure we got all our sites covered. And that was a major push towards the end of last week from the regional and national team, but it's gone a bit quiet on that front, and that's just another sort of symptom of the very rapidly changing programme around all things to do with vaccines. So I suspect that will happen, but might not be as quickly as we'd have hoped. And then finally, on vaccines, in relation to vaccinating our patient cohorts, and again, we've understandably getting a lot of concern from our staff around the very vulnerable groups, particularly those that are in secure settings, people on the elderly wards with confusion and dementia, and those that are more disturbed. Again, we had hoped that we could, through becoming a hospital hub or getting some priority stock, start to vaccinate these groups, but at the minute, we're not going to be able to say when that's likely to happen. But like I say, the situation changes on a daily basis, and we'll keep all our staff updated in the comms and more broadly as to when we can start to do that. And then before I finish, to go to Tracy. Just sometimes people saying, okay, this is all very well, what about the rest of the stuff that we do ordinarily, sort of 99.5% of the time? We never hear about that. Don't worry, it's in hand. But some of the things that take up so much of our time internally, such as the strategic planning, the financial planning for the following year, is being covered, but a lot of it has been sort of thinned right down. And so, for example, the planning for the first part of the next financial year, from a financial perspective, is what's called been rolled over on a block contract. So a lot of the activity and the performance and the way the money is paid is basically just being moved across the year, and there'll be calculations and work undertaken to top things up and make sure it all evens out, which on the one hand does save a lot of time and resource, but on the other hand it's not frustrating, but it means that there's less ability to influence change and move things forward as you would ordinarily do in a planning cycle like that. But there's still lots of that work going on, and to acknowledge that as well, that there's a lot of people in our teams that may be thinking, oh, I'm quite a way off the COVID stuff, but I'm still working, and it's important that we acknowledge that good work, that it's the right thing to do. It's our core business, and it keeps lots of people safe in the longer term. So to finish off on, again, to reiterate and thanks to everybody, and to just say, in terms of staff wellbeing and support, this is critical. We know that people are really tired, and we know that people are working above and beyond in difficult circumstances, in challenging environments. It's important to stay well. It's important to take leave. It's important that you find time to sort of step out of the theatre, as it were. And the army are working with us. That's just a new term I've used, that they talk about being in theatre when you're busy doing stuff. And it's important that we know about what's on offer from our staff health and wellbeing team. I think this has been a tremendous piece of work that lots of people have been involved with over the last year or so, and we've gone to having a fairly ad hoc bunch of some good bits, but important bits that we're missing. And hopefully, if this all works in a seamless way, Tracy's now going to give us a summary of all the fantastic things that that she's helping lead on. So that's it from me, Paul. I'm going to hand directly to Tracy. I think that's the plan. And just again to finish, thanking everybody for their contributions over the last month. Tracy, over to you.
Lovely, thanks, John. I've got a bit of an echo myself actually there. There we go, I think it's gone. So yeah, I think this year's been incredibly hard for lots of people. That's me, that photo of me when I first started. I now look 10 years older and at least 10 pounds heavier. And that's you know, an easy year compared to what many of our colleagues have had. I'm going to try to, John's laughing a little bit too much there at what I just said. I'm going to try and cover some of what I think are the hot topics. And if we weren't in lockdown, we'd be hoping to do a bit of a wellbeing roadshow on tour. January is a great time of year normally, isn't it, to reflect on the year you've had and the year that you want it to be. And with so much uncertainty, what I'd like to share with you is some of the resources that are available to help you as individuals and your families navigate through, you know, this second long period of lockdown and whatever the future holds for us. So what is new and hopefully improved is our new mapped out intranet pages for staff. So we had some feedback from people to say there's lots of content there, lots of good things, but, you know, perhaps we struggle to find what we're looking for at the time that we need it. So we've now zoned the intranet pages into those 4 areas that you can see in front of you under core services such as occupational health, the in-house counselling provision, the MSK services that are run by our excellent physio team, alongside emotional and mental health, physical health and other resources. And I think what we're hearing from people at the moment is that actually, sadly, people are needing significant support to come to terms with personal loss, such as bereavement, family issues, such as children coming to terms with another lockdown, and for some, homeschooling again. So what I want to do, if I can, is just take you through some of these pages. If I could just go to the next slide. To help navigate around the support services, you hopefully would have all received a letter thanking you for your contributions signed by John and Paul, and also a staff wellbeing leaflet. The leaflet's on the intranet pages as well, but these slide set will be shared with some helpful numbers for quick reference. So should anybody feel that they need support, at least they'll know where they can go to and how to contact those services. And then just moving on to the next slide, a little bit more detail around our 24/7 staff support helpline, which is provided by VivUp. So we have an absolutely amazing in-house counselling service who can offer a specialist counselling approach. And I think what many people didn't know that VivUp offered, once you register as a manager or employee, is a range of services which you can see on the screen in front of you, from debt advice. We've been hearing from colleagues whose partners have been furloughed or made redundant, so they become the single household income, presenting significant challenges for outgoings such as mortgages and other financial commitments. So really stressful time for people. So on these pages, once you register, you'll be able to download a number of self-help tools and kits and speak to professionals within these areas, such as parent-child relationships. There's lots of apps on there and self-help workbooks. And to the bottom right of this screen, you'll see an example of what some of those self-help booklets contain. I was perhaps not surprised to see that one of our most downloaded at the moment, maybe it's the festive period, maybe it's a sign of the times, was Alcohol and You. So that's a download that's being accessed frequently by our staff. Perhaps it's for a friend of a friend, you never know, but I'm just delighted to know that people are accessing those leaflets and support when they need to do so. So there's lots of help from VivUp. The numbers are on the Connect page, and as I say, once you log in, you can download PDFs, self-help guides, audiobooks, so it's available and accessible for all. But in addition to that, we're also really lucky, I think, in the NHS to have access to another service at our fingertips. So if I could just ask for the next slide. And that's a range of support that's available from our NHS people. So I've just done a screenshot of the landing page into this area, and again the links are all on the internet, or you can contact me for a helpful list of links if that's easier for you. But there's again a helpline. I specifically wanted helpline, and there's a really good booklet that you can download from our NHS people as well to support people who may have lost loved ones over this difficult period. And then on the apps, there's lots of fun apps as well. So obviously it's very difficult for many people, but for some of us, including myself, I'm thinking about how can I get back into my healthy eating regime, physical activity, all the New Year's resolutions that we often have at this time of year, which actually I think for many is about how do we get that back on track and start looking after ourselves, knowing that things aren't going to be back to perhaps what our normal looks like for some time. So please do access those resources. And just to move on to the last slide, we had a little bit of fun over Facebook, the staff Facebook page. It does get a bit heavy on there sometimes, but it was nice to have a bit of banter around people's New Year's resolutions, and Dry January didn't seem to be landing very well. So I thought, well, let's get a team together for Red January, which is linked very much to physical activity and promoting positive mental health. And we currently have a team of over 50 colleagues who've joined us on that mission to take part in some sort of physical activity daily throughout January, whether that be, you know, a 60-second plank or a jog around the park, or for our once a day exercise. So those 50 colleagues are enjoying a little bit of a challenge between us. It's not too late for people to sign up, so I'm just going to look at the panel here to see how many nods of, oh yeah, I'm interested in joining that. Paul, yeah, can see that in his face, he's definitely up for it. John, looking keen behind his glasses there at joining in. So if you feel that actually things do need a little bit of light-hearted attention at the moment, please do join us on Teams Not Healthcare and be physical activity, increasing physical activity for the rest of this month, and feel all the benefits that we know that brings to the stats on the left hand side. So that's a very whistle-stop tour around the support services we have available, and I think my lasting message with you is that if you need anything from relationship breakdowns, there's free couples therapy from Relate, through to bereavement support, through to just doing something fun like Red January. It's there all on the internet pages. If you haven't got time to scroll through, or you're managing a large team and you'd like a little bit of a presentation in one of your team meetings, then contact the staff support team, and we're keen to continue to raise awareness and deliver that message that, you know, we're here for you, and you don't have to be facing all of these challenges on your own, and we'll do our very best to get you the support that you need at the time that you need it for whatever that presenting issue may be. So on that note, I'm going to hand over to Michelle Malone for our good news story with her slide set, and thank you very much for letting me speak to you all today.
Thanks very much, Tracy. Hello everybody, I'm Michelle Malone, one of the clinical directors in adult mental health, and myself and my colleague Andrea have been asked to come and talk to you just to shift the focus a little bit onto clinical services and what we've been doing in relation to our changes in personality disorder pathway. Obviously the service, especially the service in adult mental health, has had lots of challenges, as everybody has in the last year, but despite all of the kind of COVID challenges, we've still managed to do quite a lot of work around moving forward with this agenda. I'm aware there'll be probably a real range of level of kind of understanding about what personality disorder means and is, and actually quite a lot of different views about that. The slide on the screen gives our working description of what we mean by this. It is a terminology which can be quite contentious, and quite a lot of our service users and carers have told us that they feel that actually having this diagnosis attached to them can create lots of difficulties in terms of the care that they receive, and that's both in terms of access to physical health as well as mental health issues. So we're very alert to that. However, we also know many people find it very helpful to have that diagnosis. So this is sort of our framing of the work that we've been doing. doing, and if anybody wants any more information around this diagnosis and some of the key clinical documents in relation to it, on the next slide, Jenny, please, we've just put some useful reference guides if anybody wants to look into that a bit more in depth. One of the key documents that we have been using in terms of benchmarking ourselves and thinking about some of the changes that we need to make is the Royal College of Psychiatry document from January of last year, so it's about a year old now, and that's a really good document if people want to have a bit more information, and we've been really looking at where we need to sort of improve our services against some of those standards. So I'm going to talk a little bit about what we've done so far, and then my colleague Andrea is going to go on and talk about some of our plans for the coming year. So we know that personality disorder is one of the key objectives in relation to the long-term plan. There is some ring-fenced investment to improve what is offered. I think what's really important is that it cannot just be a health offer. And if we are truly going to transform and improve how we care for this cohort of patients, then it has to be in conjunction with community, with primary care, with our voluntary sector colleagues, and this is some of the work that we've started to do and we really want to do much more of in the coming couple of years. No wrong door, I think, is a real key one. Many of the complaints that I see are where people talk about a continual cycle of assessments before they get to a treatment option, so we're really trying to make sure that that happens straight away for people and in a much more timely way, that we are offering a range of treatments which are NICE compliant, and that everybody has access to that's consistently available. And whilst this investment is targeted on community transformation, we're also looking at our pathways and work on inpatients and on crisis and home treatment responses as well. Next slide, please. So we're sort of clear about the national picture and the national expectations, but we felt it was really important to engage with people who are currently using our services and our staff who are currently providing them. So we have throughout the latter half of last year, we did a huge engagement piece of work where we had some questionnaires which we sent out via social media. We had over 100 responses. About half of those were from service users and carers, the other half from staff. So we got a lot of really good information about what people currently think locally about what's provided. And we did 16 focus groups so that we could get some more real in-depth information, again from service users and from staff, about what they really like about what we do and what they want to see changing. And via that, we had a number of people who came forward who were really interested in co-producing what our future models look like. So we've developed a service user and carer reference group, and at every step of the way they're sort of helping be a bit of a critical friend to us and helping influence our development and implementation plans. One of the key elements that we need to think about is the employment of peer support workers. This is really key in this area of work. So we are increasing the numbers of people we employ, and we really hope that that will help us have some impact on the kind of underpinning values and culture that we know we've done lots of work on, but we still need to do more for this particular group. Next slide, please. So the key sort of outcomes and recommendations from all of that engagement work are these here, and I guess they really do mirror what we know are some of the key things that we need to change. A real emphasis on our use of language and terminology, and an awareness that sometimes that can be perceived as being quite pejorative, so we need to really think about how we are quite careful and have a shared understanding about how we talk about people's needs, and much more focused on trauma-informed approaches and interventions. I've talked about peer support workers. a lot of what people told us is that in some areas you can get really good interventions, such as dialectical behaviours therapy, for example. In other areas it isn't there, so we've got to make sure we are systematically offering these interventions, and we've started to do that across our community teams. And really something about consistency of relationships. We know that often what's needed is long-term support, so it's about making sure that we enable our staff to work long-term in this way. And a big area for improvement are gaps in primary care, and often people describing no other options than referring into secondary care. So we've been working really hard on developing a range of options in that arena, and clearly wanting to improve overall training, supervision and support for staff. Next slide please, Jenny. So some of the things that we've already done to try and meet some of those objectives: we have commissioned a couple of services with Mind in Mid-Nottinghamshire and with Turning Point in Greater Nottinghamshire, so that there is more of a voluntary sector community offer. And the Mind service has now been running for a year. The Turning Point one has just started in the last few months, and they've both had fantastic feedback from service users, and it's enabling many people who would have come into our service and been on waiting lists access sort of support and treatment options really quickly. So they've been really positive, and we want to increase the capacity of that in the coming year. We've been developing a sort of complex care panel, so that where people are really struggling to identify how to best meet the needs of people, they can get some really good input from a range of multidisciplinary professionals, so that they are sort of supported, and that's for our inpatient services and crisis services as well. And finally, we've actually used some of our investment to shore up our sort of expertise, and Andrea, I'm going to pass over to Andrea now, who's going to talk a bit more about what that looks like.
Thanks, Michelle. Can we move on to the next slide, please? Hi everybody, my name's Andrea Cockram, and I am the new clinical and strategic lead for the personality disorder pathway. And as Michelle just says, we've really tried to shore up some of that investment and that level of expertise within our service. And what we've done is we have created some new roles that sit within this idea of a hub. And we've been recruiting over the past few months, and really pleased to say that we've successfully recruited into all but 2 of the posts, and we are in the process of looking at the other 2 posts in the coming weeks. So what we have, hopefully, is a level of expertise and a level of enthusiasm to work with this patient group, because as we know, it can present a significant amount of challenge. And what we're trying to do is have this as a very outward facing team, so it's not a service that people will be referring into as such. What we're trying to hold on to is that idea that still we want personality disorder and individuals that present in those ways, it remains everybody's business. And so our team is about supporting the system and supporting teams to be able to develop and deliver those kind of interventions. One of the posts that, I mean, we're excited about all of the posts, but particularly around our CAMS transition practitioner, because this, again, within the long-term plan, but equally within any documents written about personality disorder, we know that transition from young people's services into adult services can be very, very difficult. And this is our way of helping to try and manage that transition. We've also got 2 peer workers sat within this team. Again, very excited about, and in some ways that's about that recognition around the feedback that the lived experienced perspective is critical when we're trying to, one, develop services, but equally support the individuals that we work with. Our personal health budgets worker, I think it's got a fancier title to that. I couldn't quite remember it. We're currently going through job evaluation, but again, this is a new and really interesting post to be able to support our service users in thinking about their kind of interventions and their care plan in a very different way, and we know that some individuals, it's not just about our kind of psychological interventions, it's about how we might be able to improve their quality of life as well. So we're going to have a dedicated worker that can work with individuals to be able to think about what else might be helpful. And we've had in the past, we know of requests like I don't know, a football season ticket. We know that somebody developed a pod in their back garden, so they had a safe space and a relaxing space to go to after therapy. So we can work quite creatively with our service users, thinking about what, in addition to those psychological interventions, might we be able to support. The next slide, please. So what is it we're going to be doing? As Michelle says, a key kind of role for this hub will be training and supervision, and that will be training at different levels. So it's thinking about what do all of our staff need to have some awareness of with personality disorder, and it's likely we're looking at taking on the National Knowledge and Understanding Framework training. But equally, are there kind of skills and capabilities that certain roles might require as well? So we're thinking around that kind of training plan, thinking about supervision, because we know that feeling contained and having that space to explore the emotional impact of the work is very important for all of the clinical work we do. But we know working with personality disorder, it is an important feature. That co-production model, so it is thinking about how do we hold that lived experience perspective throughout everything that we do, and through our training, through our supervision, through our service development. So again, a key feature of what we'll be doing is thinking about how do we embed that and sustain it as well. Thinking about timely assessment and treatment, again, to support that no wrong door idea. So being able to offer a robust assessment so that we're able to then, that can inform our treatment plan, so that we're not bouncing people across services with multiple referrals and kind of getting lost in a system. So there's something about thinking about what that assessment process needs to look like. And again, being able to offer treatment in a timely way, so that we're trying to think about waiting lists and not having people, because again, people are significantly distressed, and having them on a waiting list for a significant amount of period doesn't feel very helpful. That consistency of service offer, so very much thinking about having a consistent offer across all of our services, so that it doesn't matter which team you sit in, you will have access to evidence-based intervention.
Just another minute or so, Andrea.
Okay, thank you. Thinking about our pilots and evaluations, so very much thinking about what this all needs to look like. So we're probably going to be looking at our mid-not space and thinking about who are our cohort, what is it that we need to be deliver, and how do we evidence that? So what's the impact that we're having? So as a part of that is very much thinking about our data and our outcomes, and being able to evidence and have that accessible, so that we can have a coherent conversation with whoever asks about who's coming into our service and what is it that they're getting and what's the impact. So very much thinking about service user experience and in all of this. So just to finish off, if anybody is interested and would like some more information, please do contact myself or Michelle. We're more than happy to answer any questions that you might have. Okay, so thank you. I'm going to hand over to Anne-Maria Newham now for the CQC update.
Hello everybody, my name is Anne-Maria Newham. I'm the Executive Director of Nursing HPs and Quality, and good afternoon. So just a really quick roundup on the CQC. So quite a few of you have heard that they've been into the organisation. They've been doing lots of relationship meetings, but they've also moved into something called transitional monitoring assessment. So they're not doing the full inspections where they used to bring 80, 90 inspectors in and just drop in with a couple of days notice. This is an assessment to see how the risk level of this organisation is. So we've already had our first well-led interview with them, and they're also then going to look at some services that they feel they would like a little bit more information about. So that's areas like CAMS, Arnold Lodge, Rampton, and some of the adult inpatient mental health wards. So the relationship meetings are really important. It gives us an opportunity to really build some good understanding between us, and they get to know us a lot. So there's regular contact between us. We keep them updated. A lot of you won't know, but behind the scenes we do a lot of updating. We probably speak to them on a daily basis. We keep them informed. We send them all our good news stories. We also tell them about any incidents, any deaths, anything that we feel that could attract any attention. We make sure that they get to know it from us first. We've also introduced the Book of Brilliance, which is a great way of us selling some great news and telling them, the CQC, all the great things we're doing. I just wanted to also say, make good use of the website. Lots and lots of people look at the website, including the CQC, so make sure that your intranet is up to date. Make sure that all the information there is as you would want to see it, and also for the outside world as well. And don't underestimate the power of social media. So they do look at our Twitter account, they do look at our information that we send out on a regular basis, and they keep an eye, and then they look at what we're doing, which is important. Next slide, please. So the other thing is that when we met with them, we had a really good presentation. They spoke to the organisation, and this is what they told us. They said, don't panic. And if you can all remember Mr. Mannering, so don't panic, Mr. Mannering. We are not expecting you to trip you up. And this is really important. They want to get a better understanding of the work we do. If they ask us for something that you don't understand, just tell them. If they use language that you don't understand, just say, oh, I'm really not sure what you meant by that. Could you explain it to me or ask me in a different way? Celebrate your successes. This is what they're saying, you know, tell them all the good things. They also really enjoy when patients are supported to get involved in the questions, or if they get involved in being introduced to them. They like that. They like to see that interaction. They also like them to get the patients to show them around or show them their own rooms. Point the inspectors in the right direction. They don't necessarily know where they're going. And remember, we start an inspection at the point of good. That's what they say. They start an inspection at the point of good. It's a really important point, that is. Unfortunately, sometimes they find areas of concern, so therefore they have to mark us down. But sometimes they see areas of really good practice. And then the bottom point, I think, is important. We have the same goals. The only difference is we follow different paths to achieve them. Next slide, please. So this is just really quickly, at the moment the organisation overall requires improvement. Rampton is inadequate. These are the judgment and publications, and this is how it goes out. Next slide, please. And then this is how they do it. So they have something on the left hand side, they have something called key lines of inquiry, and you sometimes hear them being called Chloe's. So those key lines of inquiries are developed through all the information that they get. So the next bit is all the intelligence that they've had. They've gathered information from lots of stakeholders. They'll have talked to patients. They'll have talked to carers. They'll have looked at our website. They'll have looked at our reports. They'll have looked at action plans. They'll have looked at lots and lots of things. And that's how they gather all the information. And then they make a judgment, and then they give us our rating. And so that's it, really. I just wanted to give you a quick update to say that they are here at the moment. They're doing that TMA, that transitional monitoring assessment. They're going to give us a rating of their assessment of us. And then we'll get a better understanding of what they're going to do over the next year. But we're doing lots of things in the organisation. We're getting ready. All of you have been doing some fabulous things, particularly around the domain of safe. Because at the moment that does sit at inadequate and requires improvement, and I feel that that's an important area for us to make a big difference and change. So next is over to Paul.
Thanks, Anne-Maria, and we're just going to try and pick up some of the questions that have been posted in the Q&A bar. John, there were a few there that relate to aspects around COVID. Did see that one colleague had shared anonymously that they underscored your message about us all really trying to remember to use PPE well at all times, because they'd seen occasionally that that wasn't the case. But there were a couple about target dates that's for the rollout for our frontline staff, but also for all staff in terms of getting the vaccine. Do you want to just give an answer to that one, John?
Yeah, so to reiterate about the use of PPE, it's fundamental, and we all know it's a drag, don't we? And it's tiring and it's sweaty and it's uncomfortable, but please continue to use it where you need to, because it does reduce transmission. Yeah, the 4 priority groups that nationally have to be done by the 14th, 15th of February, which includes the over 80s, care home staff and residents, health and social care staff, and they're also now starting to roll out letters you'll have seen on the news for 70s and over. And it's the 14th, 15th of February, which is the deadline. I think there's probably going to be a little bit of uncertainty around or clarity required on those staff that don't have any patient-facing parts of their role at all, and that's I realise I put in the written answer that we're still working on making sure that's as close to the middle of February as possible. There are 2 constraints around that. One is that at the moment we don't have full control over the booking of our staff, and up until today really we haven't been able to have continually open booking queue sites that staff can log on to. We did a trial run last week, and it was full very quickly, but we're about to open a load more today. And then the other thing is the vaccine supply. So that's been relatively sporadic. It's getting much stronger, particularly with the rollout of the AstraZeneca vaccine, which is much more easy to store, as everybody knows. And we're getting thousands towards the end of this week into the system, and so availability will be much better. But sorry, it's a bit vague, but the vast majority will be in the middle of February.
Okay, thanks, John. And a couple more just in relation to vaccines. Somebody asked about whether as staff they need to wait to be asked to book, or whether they can use somebody referred to as Swift Queue booking facility that had been shared on the Facebook site, and also somebody else had asked about whether they can go to attend a regional hub elsewhere, like Birmingham or somewhere like that.
Yeah, so I don't know if Claire's still on the call. She might have a bit more up to date, but we talked a bit about this with the exec earlier today. Is that so? The rule at the moment is wait to get asked and invited, but increasingly through this week and into next, staff will have availability to book their own and to log on through Swift Queue. Is the service that a lot of trusts are using, and we know that a lot of our staff don't necessarily live in and around Nottingham or even in Nottinghamshire, and they may be closer to other centres like the huge thing they've got set up in Birmingham, and also there might be increasing access through their own GPs. So the important thing is if you get invited, and you're certainly before the middle of February, you've got patient-facing part to your role, then take up the offer if it's your first dose. You shouldn't be allowed to get in if it's your second dose. There's a national ban on that. But if you do have it out with our offer, then we just need to know that you've had it, because it's so that we can report it in our figures. It's a bit like the flu vaccine, really.
Great. Okay. Thanks, John. And as somebody who I know I am well down the list of people in this organisation who'll get vaccinated, I've certainly got an interest in us being able to get to the stage that we can all get vaccinated. There was a question about whether we're putting. Oh, sorry. Just to say on that as well, I've had a note that there will be more in today's end of day comms in relation to how to access the how staff can then book for vaccines. John, there was a question around will we be providing particular support for staff who have long COVID?
Oh yeah, so that's a good question, isn't it? And we know that that's a significant issue for a number of people, not just the elderly, and it can cause all sorts of longer-term physical and psychological difficulties. Chris Schofield, who's one of our liaison psychiatrists, has been, I think, working with the national team on describing how these long COVID clinics will work and what sort of functions they need to have in them. The short answer is yes, we will be having them set up locally, but I haven't got any detail of where and when and how people may access that. So that's, I'm probably on the call, we haven't got anybody that can answer the details. So we need to get that detail, so put it into a later response, if that's okay.
Yeah, great. And then just one quick one back to Michelle and Andrea. There was a question about, Andrea, were you referring to rolling out CUF training, KUF? Can you do literally just 30 seconds on that?
Yeah, so the KUF is a nationally recognised training at awareness degree and master's level in personality disorder. So we're totally anticipating that it'll be a requirement of this of the community transformation plans, and so there's a lot of talk around kind of re-establishing the KUF within trust and thinking about the structure that we need in order to be able to deliver on that. So we're hoping over the coming months that we will be in a position to start rolling the KUF, the Knowledge and Understanding Framework for Personality Disorder, out again.
Great. Okay, I think we need to move on. If I've missed any of the questions in the bar, we will be able to make sure that answers get fed into the briefing that goes around. John, do you just want to quickly introduce the next piece, the video?
Yeah, thanks, Paul. So you'll be pleased to know that it was a long rambling introduction from me, about 5 minutes of thinking about respect, but you've been saved from that. This is a much more helpful, informative video from some of our people talking about respect, part of living our values. The only thing I would add is that for me, it's about making sure we listen, hear and respond to everybody's point of view and contribution. Because everybody's got something important to add. So cameras roll, please. Jenny, Alex, whoever's pressing the buttons.
I think for me, respect is really important, particularly in those times when we can have different views and opinions on work, clinical cases, referrals, and any workplace issues. I think respect is about being able to have healthy disagreement and debate in a way that is safe and constructive rather than dismissive or defensive. And it means that questions can be asked and concerns can be raised. And also we can negotiate and we can try to understand those differences of opinion, and that contributes towards patient safety, better outcomes, teamwork, and also helps with staff well-being and working together. For me, respect means assumption of positive intent or best intent, and having a compassionate curiosity about what those conflicting views are and how differences of opinion could be resolved or understood better.
Respect. What do we mean by respect? I suppose for me, respect is an inherent value that we all carry, or we should carry, And that, I mean, every individual person is a person of worth and has a purpose to fulfill. And I say that very broadly. Respect starts with yourself. It's about being kind to yourself so that you can be kind to others. It's about valuing opinion. It's about treating and valuing different people's backgrounds. It's about valuing people's talents. And I suppose, in a nutshell, it's about ensuring that we allow people to feel good about themselves and recognize the good within each person. So I think what sums it up for me is a saying that I've carried with me over the years, which says, people don't always remember what you say, but remember how you made them feel. So let's enable us be in a position where we're making people feel good about themselves so that they can be good to other people.
Well, that's good, wasn't it? Two of our very, very classy leaders there, and thanks to Rachel and Tich for that contribution. Really sort of on the button insights. Just to finish, celebrating positive stars who make a difference. There's this is becoming increasingly popular, and it's so important, isn't it, to recognise individuals and teams that are making a massive difference. And thanks to everybody that's getting nominating. And I think this is probably the largest number of nominations we've had. 56. You can see the numbers there for December. So well done everybody to just getting nominated. It's a brilliant achievement. And I was going to say something else about this, but it's slipped off my mind. Other than say, well done to everybody, and it's great to see this continuing. There's a list of everybody and all the teams that have been involved, and I'm very briefly going to hand back to Paul to wrap up and say goodbye. So thanks very much.
Thanks very much, John. Just to say that we'll do this all over again on the 8th of February, 12 till 1 for that one. Thanks to everybody who was able to join us. Thanks to all colleagues for a really great set of presentations. And whilst I know we were talking a lot about the vaccine and COVID, it is just really good as well for us to find a little bit of time to be talking about some of the other great stuff as well. So thanks very much, everybody. Keep on staying as safe as you possibly can, and see you again in February. Bye.